Okay, welcome everyone to Spaces of Health, where today we're having a live chat about aging in place. We have a panel of experts here who will be introducing themselves and their relationship to aging. My name is Loretta DiPietro. I'm a professor and chair at the Milken Institute School of Public Health at the George Washington University, and I study aging as an investigator. So let's start with you, Anne. Please introduce yourself. Anne, I think you're on mute.
Right, got it. Hi, everybody. I'm Ann Montgomery. I'm Deputy Director of the Center for Elder Care and Advanced Illness at Alterum Institute. Here in Washington, D.C., Alterum is headquartered in Ann Arbor. I have a long history in health policy, worked on the Senate Special Committee on Aging for 7 years, the House Ways and Means Committee, and in general, I have a love for long-term care, aging in place issues, family caregivers. Really looking forward to discussing this with you today. Thanks so much.
Thank you, Anne. How about you, Gail?
Good afternoon, all of you. I'm so pleased to be here. My name is Gail Cohn. I'm the Age-Friendly DC Coordinator. I was hired in 2012 to implement the World Health Organization initiative that 280 jurisdictions across the world are seeking to change themselves into easier places for people to grow older. There is recognition that people are moving increasingly to cities and that we are living much longer than we have in the past, and that as a result of that we need to change our jurisdictions so that they are easier places to live. I have been in this arena working with older adults since my hair was blonde, not white, and as a consequence I've seen a lot of things change, which is wonderful, but we've got a lot more work to do.
Thank you, Gail. Okay, Melissa.
Hi, good afternoon, everyone. My name is Melissa Gong Mitchell. I'm the Executive Director of the Global Coalition on Aging, and we are proud to work in collaboration with the Milken Institute School of Public Health to help put on this webinar. We work with global corporations across sectors, from technology, financial services, health and pharmaceuticals, and industries like home care, who are looking to find solutions to some of these upcoming challenges and current challenges that we're seeing in the face of population aging. So we feel like we work with some of the greatest innovators in this space, and healthy aging and aging in place is one of our top priorities. So we're just proud and happy to be part of this conversation today.
Thank you. Okay, Phil.
Hi, good afternoon, everybody. My name is Phil Bongiorno. I'm the Executive Director for the Home Care Association of America. The Home Care Association of America represents private duty home care providers across the United States. We have about 2,500 members. We have about 400,000 caregivers employed by our members, serving about, 500,000 caregivers serving about 400,000 seniors and people with disabilities around the country. Our member companies provide about 1 million hours of care a day throughout the United States, and I'm really happy to be here. My personal background, I've been involved with health and disability issues throughout my whole career. I started out in Philadelphia, and I served on the Mayor's Commission on People with Disabilities some time ago, and worked on getting the Americans with Disabilities Act passed. So I'm really happy to talk about this issue today with all of you. Aging in place is very near and dear to my heart, but also our organization is very much in a position to be helpful to serve people with disabilities and those and seniors to help them age in place, and I'm glad to be part of the conversation.
Thanks, Phil. Okay, Robin, you're last.
Okay, I'm Robin Strong, and I'm the founder and creator of Disruptive Women in Healthcare. And we've been working with a global group of women on a number of issues, but two that are relevant for today's conversation are our Health in Place initiative, or HIP, and then Aging Audaciously. We're doing a series around various topics related to aging. It involves everything from social determinants of health and support systems to looking at all aspects of aging, the positive aspects of aging. It's not all negative. And what are some of the policies and the trends outside of healthcare that are critically important for aging and aging in place? And it's a pleasure to be here with all of you.
Robin, it's a pleasure to have you here. So we're going to start off a discussion, and you know, I've been studying healthy or successful aging for close to 30 years, and when I first started, nobody had any idea of what successful aging was. It was aging, you know, had always been characterized by this slope of inevitable climb. And so we now know differently, right? And we know that there are audacious and kick-ass older people who are changing the world and making their communities and their lives a better place for themselves. Let's start the discussion with successful aging, right? What is involved in successful aging? If you had to, we'll go across the panel, if you had to pick one or two things that characterize successful aging, what would they be, right? Okay, go ahead. You want to start off, Anne? Two things.
Sure. Well, I think successful aging, in my view, is being able to live in a place of your choosing. Most often that would be your own home, not necessarily always, but most often, and also being able to count on the services that you need as you grow older. Since so many people, probably most of us on this call, will live to their 80s, perhaps beyond, in the latter part of life, we will need some assistance in order to remain comfortable, in order to age with dignity, to really remain independent, to stay out of medical crisis. So the ability to get health-related services, not just medical care, but the supports that we need for daily living, whether that's eating, bathing, dressing, or shopping, things like that. A little bit of hands-on assistance is critical. So I would define successful aging in those terms, and also for everybody, not just for a few people or for those who happen to be in one plan or program.
Thanks. How about you, Gail? How would you define successful aging? Give me two concepts.
Engagement.
Ah.
Engagement is absolutely essential for all of us, which includes purposeful living, not just doing things that people think are going to be good for you, but doing things that cause those individuals who are working with you and living with you to say thank you because you've done something that they are pleased by. So engagement. And then the second issue has to do with how well the environment around us enables us to continue to be part of everything that we want to do. So we have to change the environment, including how one gets in and out of the house, how one gets around and uses the things in the house so that we can get from where we are to where we need to go in order to be engaged.
Nice. Okay. Melissa.
Yes, I want to take those concepts, which I think are absolutely correct, to just a little bit of a different step, because I think healthy aging and successful aging means thinking about how we are going to live this extra portion of our lives that the generations before us didn't have the benefit of. So if I'm going to live 20, 30, even 40 years longer than my great-grandparents lived, it's a whole concept that I have to rethink. Not only where am I going to live, how am I going to age well, but what am I going to do with all that extra time? So I have to think differently. It's not just time tacked on to the end of my life, but it's how I live my life course differently. So how I work is going to be different, how I save is going to be different. The concept of retirement is not going to exist anymore because I want to continue to contribute to society each step of the way in my life. So career is going to be different, saving is going to be different, education is going to be different, how I pursue my dreams is going to be different. So it's not just going to be pushed off at the end, but I want to think of the concept as breaking up the life course a little bit more, so that we have enough fuel in the tank to make sure that we fulfill that full life course. And I think a really important component of that is our health, and if we're able to stay healthy and active. And I think breaking up the life course in that way is one way to help ensure that we maintain our health. And health is very much contributed by our genetics, which is not a whole lot we can do about. Our own personal characteristics, how we live and how we work, who we associate ourselves with, our behaviors, really what we eat and exercise and all of that. And the fourth determinant that the World Health Organization has identified is what our environment is, who we surround ourselves with, what is the support system we create for ourselves. So I think talking about aging in place and being in the home and being in community is really a central pillar of what our health looks like, and therefore what successful aging looks like.
That's great. Thanks a lot. Okay, Phil, you're up. Phil, I think you're muted.
I apologize. I thought I unmuted myself. Can you hear me now?
Yep.
Great. Sorry about that. I was saying that I don't have much to add to that other than I would...
Okay, we just lost you. You just got me. Okay.
Can you hear me now, I think?
Yes.
Okay, now that's better. I thought that I had unmuted myself. I apologize. I was saying that the two things that I would look at is quality of life, those types of indicators that really look at quality of life. And I think Melissa mentioned the idea of what it means to be to age in a healthy way. The way we look at that is there are a number of measures out there that indicate to determine what is a quality of life as you age. Some of the measures that are out there looking in the healthcare continuum is, how are we keeping people from going back into the hospital after a surgery, or how are we preventing them from going into the hospital in the very beginning. I think the other items that we do as an association, our member companies do, is provide those kind of services to make sure that people are living healthy in their homes. The activities of daily living that Ann mentioned are some of those specifically what our home care companies actually provide. So from that perspective, we're really, our member companies are doing that every day with their caregivers. So that's a perspective I bring to this, is that we provide a quality of life. How are people aging in a quality manner, and how are they maintaining their health as they age in their homes?
That's great. Okay, Robin, what I'd like to hear from you are some of the social and political determinants of successful aging. Yes, a good bit of it does depend on your choice of parents, but at the same time, there's a lot going on in society that interacts with that and allows some people to live longer in a more robust manner. We've got a handle on some of the behavioral determinants of that, but more importantly, what are some of the social and political determinants of successful aging? Wait, you're on mute.
Can you hear me?
Yep.
Okay, great. I think David Bowie said it really well when he said aging is an extraordinary process where you become the person you always should have been. And how do you become that person? Part of that is what you yourself, your life experience bring to it. But I think that while we were just talking about the physical aspects of healthy aging with environmental and health of body and mind, there's also the social, to your point. And what I think we've been working on and need to do a better job on is how do you flip the stigma that people have against aging and old age? AARP keeps lowering the rate of who's eligible. How do we define value that encompasses all of the respect, the dignity when you're interacting with whether it's the direct delivery healthcare system and patients who may be there with the older adults who may be there with their children, and the physician or the care team talks to the not to the older patient but to the caregiver or the family member. There's no reason not to engage one-on-one. So we have a lot of work to do with flipping that whole notion of what is the value of an older person, and I think that speaks volumes to what you're talking about.
Thank you. Thank you. Yeah, so with regard to aging in place, let's talk about some practical issues. What resources are needed to age in place? We can all say money, right? But what are some of the other resources that are necessary? Go ahead, Anne.
Well, I would say that connection to your community, to your loved ones, not being socially isolated is fundamental. I think social isolation is now actually being recognized as one of the major social determinants of health. So I think that even for people who lack family immediately around them, there are ways of creating volunteer, caregiver corps, for example, at the local level that can go in, that can assist people, that can befriend them. I think it's absolutely fundamental that as we get older, we can't get isolated or things really don't go well. So that's my major answer.
Okay, so community and community engagement, yeah. I think that requires a certain amount of community capacity within one's living environment, within one's neighborhood. Okay, Gail, what are some other resources?
What a nice place from which I can build what it is that the World Health Organization is pressing us to accomplish. We have got to change our cities, our communities, in ways that have to do with engagement to enable those who are growing older. And by the way, we need to keep in mind that once conceived, one is growing older, and there is an importance that should be put to the fact that how we deal with prenatal care, how we deal with early childhood, how we deal with early adolescence, and how those individuals go through a process of getting an education affects greatly what it is that one becomes as an older person. So we need to keep the life continuum in mind here as a means by which to structure those interventions that we think about that have to do with older adults.
Thanks. Okay, Melissa.
To this question, from our perspective, we work with a lot of different global companies, as I mentioned, from different sectors. And so it's important for us to assert that business has a very important role to play in this, because this aging, the aging situation that we're in becomes a really big opportunity for innovation. And we are really seeing that across many different sectors. So we work with financial services companies who are devising new solutions for saving better for longer lives. The concept of retirement isn't going to exist anymore. If you might have to contribute to the care of your aging parent, saving is very different. It's not just picking funds to invest your money in. It is about how to save for the things for a longer life, which is different from times previous. New sectors are arising in this space to help fill the need of this growing continuum as we age. What Phil will talk about with the home care sector is it's relatively new. It's been around for a few decades, and it is filling a gap between institutional care and hospital care that really didn't exist a few decades ago. So there's new innovation in the business sector. The healthcare sector is adapting to try to be more focused on the health of individuals as opposed to just being focused on care. We're seeing technology come in and emerge as new ways for monitoring and telehealth to connect people with their care networks, to connect people with their physicians, to ensure that there is safety when people are in their homes, as well as peace of mind for the family caregivers who play a very, very important role in what this looks like to age in place. So we believe that business partnering with governments and incentivizing that innovation is very important. So we want to see more and more of that, and we're seeing some really exciting things happening in this space.
Wonderful. Phil.
Thank you. Yes, and just to follow up, can you hear me okay? I want to
Yep.
make sure there are little technical issues here. So, as Melissa mentioned, I think some of the things that we offer are the kind of support, the supportive services that are needed to help people age safely in place at home. I think the services that home care companies provide to support activities of daily living, we're looking at ways that how do we correlate those services to equate to quality of life, and that's really something we're trying to research a little bit more to really provide that connection, that true connection between those services and what it means to age safely in place. And safety was the other concept that I wanted to bring forth, that if we can help someone understand what obstacles are in their home environment, come in and look at that, that's very important, I think, to make sure that your environment in your home is safe, and not only from a safety perspective when it comes to the environment in your home, but also how are you safely living free from elder abuse and other concerns that we have when it comes to caregiving and other things. So those are a couple of things that come to mind when we talk about the resources that are needed to help age in place.
Great. Robin, what do you have to add?
Yeah, I would say that certainly agree with everything that's been said. And one of the things that we're doing in our Health in Place initiative is trying to figure out creatively, because when you talk about needing more money and resources, all of the things that we've talked about with improvements in your home, however you define home, and so forth. But we know that Medicare, for example, is not going to be, at least anytime soon, expanding its basket of benefits and so forth. So how do we come together with experts from housing and transportation and tax experts and redefine essential health care benefits? If we know that there's technology that needs to be embedded in the home to keep somebody with Alzheimer's from wandering away, or some kind of safety alert, that's never going to be deemed an essential health benefit. So how do we package all of the things that we know are necessary and think about maybe incentivizing home builders with a tax incentive? How do we think creatively outside the typical silos that we all work in, so that we can look at this from just a different vantage point and try to bring everybody together and solve it through a different framework?
Wonderful. So what I've heard is, in order to age in place successfully, that becomes dependent on a certain amount of individual capital, education, emotional stability, etc., but also social capital concerning your links and networking, engagement with your community, also financial capital, right? And with regard to the many resources that it does take, financial resources and reimbursement, to do this well. So my next question is, is this something that, are we about to create another health disparity, right, with regard to people's ability to age in place? Do you think that there are evolving any socioeconomic, gender, racial disparities with regard to this movement? Okay, who wants to stand? Go ahead.
That's a huge and important question, and it'd be fun to hear from everybody out there as well. you know, basically we've kind of separated medical care from all of the community resources and often quality of life sort of artificially. And we can't afford to do that anymore. We really need, I think what we're talking about in many ways is to figure out how to blend them. It's not easy in the policy world since we've built our programs to do specific things within specific budgets and so on. But we do have the resources. We actually do. Many more of the resources are on the healthcare side, many fewer on the day-to-day social support side. So in order to kind of solve this puzzle, unless we want to spend a whole lot more on healthcare as we double the population of older people, which I don't think is likely, we have to be creative. We have to stand up programs and communities and initiatives that address, you know, the entire spectrum of needs that include those social determinants of health, which are, after all, 60% of the puzzle, really, of what makes us healthy or not healthy as we live, grow, and age. So I think that's possible, but it's kind of a new era where we're going to have to break down the silos between programs, between benefits, between, you know, the sectors, really, of medical care and everything else, and rethink what we actually have.
Good. Gail.
That's the entire premise upon which we have been functioning with Age-Friendly DC, is breaking down those barriers within the government and from the community and the government working together, and not thinking about the answers coming necessarily from the government, more from the communities in which an individual lives. I like it when I know that there's someone who knows every person's name at some point or another in the community. So when the person is vulnerable, is there someone who knows that person's name and has that person's interests in mind with regard to keeping them engaged? And we're so very fortunate in DC because we have more senior villages, groups of people who want to age in their own neighborhood, which have developed than any other jurisdiction in the United States per square mile. So that kind of activity, plus the faith-based community, which has been doing what villages do for years but haven't recognized themselves as having a responsibility to work with those who are part of their affinity group, it is an important piece to be involved in the continuum of community services that that individual is in.
So Gail, you know better than anybody the 8 or 9 villages spread across the various districts of Columbia, and do you feel that there's equity across all the wards with the aging in place villages? Do some have more resources than others? Are some better organized? What's your sense?
The issues with villages, and there are now 11.
Yes.
And that's how far along we've moved in DC. The idea catches on. But it is an equity issue. There are individuals who are more likely, and this is a self-organizing group. This is a grassroots group of people who've gotten together and said, we want to stay where we are in our neighborhoods. How can we do that together? How can we make that happen together? And that has not happened in the lower income parts of the city. It's happened very well for some organizations who choose to involve those who have lower incomes within their organizations, but not all villages have chosen to go that route. If we had more equity going on within the villages and the faith-based community recognizing that they're doing the same kinds of things, it would be great.
Okay, great. Melissa?
I think to add to that, this community concept is really core to what it's going to take to be successful for healthy aging and for aging in place. And there are fantastic initiatives that are going on all across the world coming out of the World Health Organization's Age-Friendly City concept. And congratulations to Gail for all the great and fast work that I've seen coming out of DC. We are based in New York, and we see a lot of work coming from the New York City Age-Friendly City initiative, which has been in place for a number of years. And it is about pulling that community together really from a very grassroots perspective, which you're describing. And I think the other piece that's important to make sure that there's not this disparity is to do this from a top-down approach as well. I think as governments are getting more involved in the conversation, looking at topics like aging in place is something that we need to invest in. I think that's a very critical piece. It's not a huge cost. It's not a Band-Aid solution. It's going to be an investment that governments have to make. And I think having organizations like the World Health Organization very much involved in this, other organizations, global institutions that we work with, including the Organization for Economic Development and Cooperation, are beginning to put active aging, healthy aging as something that's on their agenda because it's a global social issue. And I think you need both that bottom-up and top-down approach. And I think as you're seeing this urbanization, you're seeing older people come into cities, you're seeing children move away from their older parents. I think we saw data that said that for each person over 60 who has more than one child, the closest one is 280 miles away. So that's a great distance. And so when you're thinking outside of the concept that your children are automatically making sure that you're taken care of as you age, we have to build this community approach, but we have to ensure that our policies, our leaders are also talking about these same things so that we can get a lot done.
Thank you, Melissa. Okay, Phil.
Sure. Thank you. And I think the biggest factor looking at some of these challenges is we've looked at is affordability. We're finding that, particularly in paying for our private duty home care services, if there's nothing paid under Medicare, Medicaid does provide some reimbursement, but you have to qualify. So we're finding this, whether you can afford it up here or have to be eligible down here in the Medicaid program, and somewhere in the middle, we're not able to afford this type of care for most people, and that's a challenge for us. I think we've worked on policies to develop a sustainable payment system, and I know we'll talk a little bit more specifically about policy, but to create a tax credit system and other policies that the government can put in place. Look at who can be eligible for certain services. Maybe there's other expansions of current programs, that sort of thing. So we definitely see that the concern, especially for someone based on a socioeconomic status, where they may not be able to have access to these types of services that will help them age in place in a healthy manner. So that is a concern.
Robin?
Yeah, the only other thing I would add to the discussion, because I think it's pretty robust already, is there is the intergenerational element to all of this, and I think Melissa addressed some of that with the distance that children don't necessarily live as close to their parents or parent as many years ago. And I think that there is a lot of opportunity for how do we figure out what that will bring to the table. And there's been some discussion about how do we involve college students with debt and get them involved in caring and caregiving and so forth. And there's a lot of interesting experimentation going on just in terms of living arrangements, in terms of debt restructuring, financial resourcing, and it's pretty audacious, I have to say. And there's some really good examples out there, both globally and here in the States.
So, on the one hand, you have a movement that is grassroots, right?
Mm-hmm.
People coming together for themselves and their community, which of course demands, as we discussed, a certain amount of personal and social community capital or capacity. Then on the other hand, in order to equal out disparities, we need this government top-down approach. How do you think aging in place will figure into, let's say, the next election? And if you, maybe not this election, maybe 4 years from now, when is it going to become something that really is on a political platform?
Well, I would say that we have an opportunity to do that right now, and let me tell you how. there is a lot of grassroots work. I think a lot of us are talking about that on this call. And we just need to bring those voices, to Washington, D.C. There are plenty of them. And to give you one example of how you can get involved today, we put together this educational platform for state party platforms, which are created by 36 states. And those values, those planks, those resolutions bubble up from the states and ultimately are incorporated in some form at the national level for both parties. So we created something called the Family Caregiver Platform Project, and it's online. You can go look at it. It's caregivercorps.org. And all that does is basically give people ideas about aging in place, essentially, family caregivers, long-term care. And it says to anybody who wants to be active, here's how you can submit a resolution, here's how you can write a plank, here are where your local caucus meetings are. Go to it, raise your voice so that we actually get these kinds of ideas, these values into the national conversation as well as the state and local conversations. And I have to tell you, it's working. So I don't think we have to wait. I think we can do it right now. I believe we've gotten language in maybe 6 or 8 states at this point, and volunteers are sort of zooming around and doing as much as they can. It really only takes, as Margaret Mead said, one enlightened, active person to make a difference. And that's what this particular project shows, and I'm sure that there are a number of other opportunities. So basically, as soon as we speak up, I think politicians are going to listen. At the national level, family caregivers in particular are really being paid a lot of attention to. There's bipartisan legislation, there's a congressional caucus that's been organized for family caregivers who are really on the front lines of trying to take care of older people and themselves, who will grow old. So I say we're there already, we just need to get louder.
Gail?
I was going to point out that as this conversation shifts to housing and keeping costs down with regard to the intergenerational piece, the whole concept of co-housing, that is 2 generations living together, has been observed by Pulte Homes, which are now building homes for more than 2 generations to live together. Having lived in a household like that for nearly 10 years in which those children grow up, and I'm a downstairs person, we live in our son's basement, that works very well. But that same concept will work for 2 other groups. One, the students who are piling up debt, who could be living in that house and doing the things that require strength, the things that require tech skills, for that individual who can be very life skill able to help that younger person to learn and proceed. But let's add a component that might attract the politicians, and that is we have an immigrant population worldwide that is struggling with where to live, and we have people who in Washington, D.C., a good example, are very interested in being helpful. And those individuals could live with an older adult who have the life skills and get the kind of tech and skills having to do with strength that could be supported. So that's controversial, isn't it? And kind of doesn't feel like what might happen right away, but I think the politicians are going to increasingly have to look at these ideas.
I can't wait till Donald Trump takes that on, that issue. Melissa?
Yeah, I want to add a slightly different sort of concept to this. I think what Anna's saying is exactly right. We do have places within the government that are beginning to address our aging population, but one of the issues that we've had with that is for much, I think maybe this is still the case, the only place you would find, or one of the only places you'll find aging within our federal government is lumped together with aging and disability. And we want to sort of flip on its head what aging means. It's not automatically associated with being disabled or being dependent. And so from the policy realm, of course, we need the right social services in place. Those are critical, but we also need more policies in place that will enable people to stay as active as possible for as long as possible. And I think it's a lot on the government policy side of things. It's a lot on the workplace and workforce side of things. And we are working closely with the World Economic Forum, with their Global Agenda Council on Aging, to push forward a concept of age-friendly workplaces and concepts of removing the stigma of getting older, taking out those stereotypes, making workplaces where they're more age-friendly. We've heard of stories from BMW in Bavaria where they changed the floor of the manufacturing plant so that older people could, the floors and the lighting and the seating, so that they could actually turn to be more productive than the younger workforces. So I think that's an important concept when thinking too about policy. It's about changing this whole structure about what that concept of aging is, and it starts with changing the view of what an older person is. So that, to me, is a very important part when we're talking to our policymakers as well. It's about changing this whole shift.
And that is the whole premise of Aging Audaciously, is that it isn't all incontinence and drooling and disability. There's a lot of value and contribution, financial wisdom, all of the things we've been talking about. And we're seeing it play out actually in the election with who are millennials responding to and understanding and getting excited about. There is an energy there that if we tap into it the right way, we can. On the disparities piece of things, this is really magnified in all of the aging issues. And one of the things we haven't touched on yet that I think is really important for healthy aging is research. And one can participate in research to benefit individuals, families, and society, and it is a way for people who may not have money to invest or contribute to a disease or a cause, but by helping with registries and clinical trials and other means, they're very much providing value and help to the greater good as different innovations and treatments, etc., are in the pipeline. So I think that's another really critical area for everybody of all socioeconomic levels, gender, and so forth. It's really a great equalizer, and we have a lot of work to do there too. It's not an easy lift, but I think it's another untapped area for getting multi-generational ages, but benefiting those who are older first.
Thank you. Phil, do you have anything to add? I know
that's okay. Yeah, just briefly, just to follow up on both what Melissa said and what Robin just said. First, with Robin on research, I couldn't agree with you more. There's been a lot of focus in the medical area about utilizing databases to observe, how certain interventions work and how others might not. And I would love to see that in the aging policy area, particularly in home care, and we are working on that type of initiative to really, again, correlate what are we doing in the home care space as far as services and how that leads to better aging in place and more healthy aging and just helping people live a more quality of life. And that could apply across the spectrum in different settings like villages and other settings also. And then what Melissa said about the business side of things, as we make the connection with policymakers about how this does impact our economy, for example, the numbers of lost hours, billions of dollars to lost productivity for family caregivers that have to leave work or take a leave of absence or take days off to care for a loved one. When there can be a solution to that, whether an employer provides certain benefits to help them assist a loved one that needs services, that sort of thing. So there's a lot of things we can do in the policy area, and I know there's at least one campaign that's actually working on a kind of a tax credit policy for family caregivers, and we're monitoring that, but I certainly think there's other things beyond that that we can certainly work on in this area.
Nice. So let's shift down a little bit downstream. And now that you bring that up, Phil, how are family care providers affected by this aging in place movement? Is it a positive thing, or Is it a burden? What are your ideas about that? Go ahead, Anne.
So, family caregivers are absolutely fundamental to our system, and they always have been, in terms of helping people who are older, who are disabled, and disabled children. The problem that we face with family caregivers is that there are going to be many fewer of them in this century due to the same socio-demographic realities that are creating the age wave. So we can't count only on family caregivers anymore, which pretty much we have been doing. Long-term care has pretty much been the province of the family and of the family caregiver. And of course, we have more women in that more traditional role than we do men, although that's changing. So the point is that we need to figure out how to relieve, really, the strain on family caregivers to diversify our system of support. And I know Phil's been talking about that. All of us have been talking about that in one way or the other. It's inevitable. It means we need to draw the circle much wider, and I think that's why we've been talking about community. So although it's difficult, it's a big shift. I think it's not only a necessary one, but a very powerful one, and ultimately a very positive one. So that's my answer.
Okay, Gail, you have to add to that?
The American Institute of Architects Design for Aging DC group have been working with Age Friendly DC by designing accessible housing, making housing visitable, meaning that there is a way by which to get in and out of the house safely, and also to have a bathroom on the same floor with the kitchen. Those changes are moving well because of the fact that in DC we have a grant up to $10,000 to help people, regardless of their abilities at the moment, to make accessible changes to their homes. And that, combined with the AIA gift that we have, we can make neighborhoods into age-friendly neighborhoods where accessibility is a feature. And that brings us back to home care providers who can then be identified in a particular area and help more than one person in a day, so that we're not leaving our caregivers who are paid in one house idle when they could be somewhere else in the neighborhood helping someone else.
Good. Melissa?
Yeah, family caregivers, I guess back to the original question, is a very important topic, and clearly we're seeing the emergence of more family caregivers who are balancing these responsibilities of caring for an aging loved one. They're likely in the sandwich generation. They're caring for younger children, or they're helping children who are in college. So they've got these financial burdens sort of on their minds. In addition, we know that more and more of these caregivers are working, and they're working full time, to what Phil was talking about. So they're balancing all these multiple responsibilities, and we're beginning to see a big trend and a big shift we're beginning to see that affects productivity in the workplace. So it becomes an issue for employers as well. So if employers begin to know and understand that family caregivers are having these responsibilities, and if they could help provide some sort of support, if they can provide some sort of resources, directing to resources, if there are saving mechanisms that could be directed towards Phil's point about incentives and things like that, or tax or ways to better save for these elder caregiving responsibilities, then that's going to, all of these things together are going to help the employee who's caring for their aging loved one to be more productive. So it becomes a much bigger issue. It's not just that family caregiver who's alone by themselves sitting in their cubicle trying to find answers for how they're going to be sure to take care of mom and keep mom at home. They're dealing with these financial issues as well, and they're dealing with these work issues. We know that about 62% of these family caregivers are actually contributing financially to care for their parents as well. So they've got this financial burden. But I think the most important thing when we're thinking about family caregivers is, what do they really need? Overall, they need peace of mind to know that their older loved one is taken care of. So we can work on all of the initiatives we've been talking about here today, about bringing in the community, bringing in policies, bringing in better ways to keep people in their home, bringing in home care, which provides a new solution connecting ourselves with the care network, then we can provide that peace of mind to family caregivers, which benefits the seniors themselves, which benefits the family caregiver, which benefits the workplace and the overall economy. So it's a big picture here, but the family caregiver is such a critical piece in it, and we need to make sure we have the resources for the family caregiver as well.
Okay, we have time now to take a few questions from people who have called in. And so unlike we'll just, if you have an answer, the panelists, just raise your hand and I'll call on you. So the first question is there research showing housing discrimination when aging individuals try to move to less costly neighborhoods? Is there anyone on the panel that can address that? Gail?
In D.C., we know that there's a paucity of housing for those who want to change their location, although that's not the common thread. Most people want to stay in the home that they're in and make adaptations to that home. They do not want to move to another location. But moving from one location to another for more accessibility is challenging because of the costs associated with that. And DC is among those locations where housing is a really important problem in terms of the burden it causes in terms of the costs.
Yeah, this is Ann. I would just say that in general, I think in many cities, certainly in Washington, D.C., there's a dearth of affordable housing. And there's even more of a dearth of affordable housing with services, should you need those, should you need somebody to go grocery shopping for you, for example. So I think we have a long way to go, and that's one reason we need to hear from people, and they need to submit their ideas, if you will, however they want to, through party platforms or any other avenue.
Okay, anyone else want to chime in? Okay, here's the next question. Are there any adjustments to chronic care practices that could improve service outcomes or reduce costs in this population of older people? Ooh, that's a tough one. Go ahead, Phil.
I'll take a shot. Can you hear me okay?
Yeah.
So that's one of the areas of research we're looking at in the home care space, where we could show and demonstrate evidence that where we are performing certain functions that will help, in particular, helping individuals manage their chronic care disease. One simple example is medication adherence programs, or making sure appointments to the doctor are adhere to, things like that. Some very basic things that could help potentially address healthcare issues, but also look at reducing costs. I know there's been some preliminary research out there done on one metric, which is readmissions, that the Medicare program is certainly looking at or already instituting relative to hospital payment. And we are looking at ways that, looking at that metric on how we reduce the number of readmissions, which actually is something very much the hospitals are very much interested in doing, not only for that something that's impacting their payment under the Medicare program, but also will, obviously lead to better health outcomes.
Great. Gail? Gail, you're on mute.
I know. I just took it off mute. I wanted to talk about medical house call program, MedStar's program, that has, I believe now, 600 or more participants, in which the chronic care management for those who are homebound, who are part of that medical practice, which is a holistic concept of having others who are involved in the group, nurse practitioners, social workers, work together to enable the person to remain home, have shown evidence of less emergency calls, emergency visits, emergency and hospital patient days, which has been effective. DC is moving toward program for all-inclusive care for the elderly, PACE, which is a program that will enable people to remain in their homes, again with a holistic concept, paid for by Medicare and often Medicaid as the partner, although it could be private pay as a partner. Again, these are nursing home eligible people, not homebound, but nursing home eligible people who aren't being placed in nursing homes but staying in the home. And this is already being done, the PACE programs, in 32 states across the country.
Anne, do you have anything to add, or Melissa?
Sure, this is Anne. I would just say that there's a growing evidence base that if you pay attention to the social determinants of health and to the relatively low-cost basic supports that can address those, whether that be transportation, which I think we talked a little bit about, or respite care for family caregivers, or adapted housing, things like that, personal care in the home on a more reliable basis than we now provide it, there are substantial savings to the healthcare system in the form of decreased hospitalizations, emergency room visits, readmissions, and in avoided premature placement in long-stay nursing homes. So the evidence is there. And I think many more folks on the healthcare side of our system are beginning to take a very close look at it. I think it's interesting that, for example, on Capitol Hill, the Senate Finance Committee is looking specifically at Medicare beneficiaries with chronic conditions and what can be done to reduce costs and improve care. And the words social supports, nutrition, transportation are popping up, in their policy options. And I think we can look to see, some of those service extensions that we've been talking about because they make sense. Paradoxically, if you spend more on social supports and services, you spend less on health care and the overall cost of care is lower. And that's beginning to be pretty clear.
Yeah, and I just wanted to quickly add, I agree all of that. We're seeing more and more and having different types of interventions along these different points in the care continuum have huge benefits. And I think Phil's probably being a little bit modest, but I've certainly seen data that shows that with home care services, so companionship services, help with preparing nutritious meals, help adherence with medication, help in just stimulating the brain, those types of services brought into the home can help reduce hospital visits down from 66% down to 58%. They can help reduce doctor visits down 25% of what it is without those home care services. So these new types of interventions are very innovative. They seem like they've been around for a long time, but they really are new in this sort of healthcare continuum, and they're very important pieces to ensure that we can treat these chronic conditions and we can keep people safe in their homes.
Thank you. Robin, I'm going to give you the last minute of this.
Okay. The only other thing I would add is I think particularly in the case of complex chronic diseases, people with multiple conditions, the use, and we're learning a lot as we go, of mobile and connected technologies and new technology that enable caregivers and the whole care team to allow even the most complex patients to receive care at home, and the work that Medicare and Medicaid are doing at looking at bundled payment and value, particularly for the care in home and different types of care teams, the work that Mary Naylor's doing and others are really, I think we're at the beginning of something that's going to teach us how to fundamentally shift where care is delivered and how it's delivered. We have a long way to go, but it's exciting to see some of the new technology that's enabling some of this. So we're very positive about the direction and always looking for new ideas and new models. So.
Well, I just want to thank all of you for participating in this discussion. This has been wonderful, and I know it has been and will be wonderful for the people who will be viewing it. In the future, I'd like to also thank GW and Spaces of Health, the MPH at GW, for allowing us this platform. So goodbye and good aging.
Bye.